When your mouth feels like the Sahara, you reach for anything to help, right? But what if the very things you think are helping are actually making it worse? That mouthwash, that morning coffee, even that hard candy might be sabotaging your saliva. Today, we're exposing the three most common mistakes people make when treating dry mouth, and I'll give you a simple, evidence-based plan to do it right. This persistent, sticky feeling isn't just uncomfortable, it's clinically known as xerostomia. It affects nearly 1 in 5 older adults, especially those navigating multiple medications. You know the struggle. Swallowing dry foods becomes tough. Talking for long periods feels nearly impossible. And worst of all, dry mouth dramatically increases your risk for cavities, gum disease, and oral infections. Saliva is your body's natural defense system. It washes away food particles and neutralizes decay-causing acids. When that defense system slows down, bacteria take over. But here is the encouraging news. Many causes of dry mouth are manageable. Often the simplest fix is identifying and stopping what you currently believe is helping. Before we dive into those critical mistakes, take a moment to subscribe, hit that button, and ring the bell. We provide simple, clear, step-by-step health guidance for vitality after 55. We promise to help you improve your life without the confusing medical jargon. Now let's talk about the trap most people fall into. It's a self-perpetuating problem we call the dry mouth doom loop. Here's how this cycle works. You feel dry. Your immediate instinct is to introduce moisture or stimulate saliva. Perhaps you grab a piece of sugary gum, or you swish aggressively with a popular minty mouthwash. These remedies provide instant, fleeting relief that lasts maybe 5 minutes. But within a short time, the candy's high sugar content or the mouthwash's harsh chemicals actually irritate and further dry out your delicate oral tissues. Your body registers this irritation and temporarily shuts down minor saliva production as a defense mechanism. The result? You feel drier than you did before you started, so you reach for the remedy again, and the drying loop continues. Breaking this cycle is the key to achieving lasting comfort. You must identify the hidden culprits lurking in your daily routine. Let's start with the one most people encounter right after waking up. Mistake number 1: relying on the wrong liquids. Many people assume treating dry mouth is just about drinking more fluid. While proper hydration is essential, knowing what you drink and how you drink it matters far more than the total volume. In fact, many of your favorite comfort beverages are potent diuretics. They are formulated to push fluid out of your body, not keep it in. The first liquid culprit is caffeine. Your morning ritual likely involves coffee, black tea, or certain sodas. These beverages contain diuretics. Diuretics cause your kidneys to shed fluid rapidly. While you initially feel cool and hydrated, the diuretic effect means your overall hydration level drops quickly thereafter. This leaves your body with less fluid reserve to dedicate to saliva production later in the day. The first action step here is simple. For every cup of coffee or strong tea, immediately follow it with a full 8 ounces of plain filtered water. This helps to counteract some of the dehydrating effect. Even better, swap out 1 or 2 daily caffeinated cups for hydrating herbal teas like chamomile, ginger, or peppermint. These are naturally caffeine-free and soothing to the mouth lining. Next, let's talk about alcohol. Many older adults enjoy a small glass of wine or a nightly cocktail. Alcohol is arguably the most aggressive dehydrator you can consume. It suppresses the production of vasopressin, the hormone responsible for helping your body retain water. Even small social amounts drastically dry out the oral mucosa. If you are seriously struggling with persistent dry mouth, cutting alcohol entirely, even for a short 1-week trial period, can show immediate, dramatic results. And finally, we must address the hidden sugary and acidic drinks. This includes fruit juices, carbonated sodas, and especially the seemingly healthy sports drinks. The acid and sugar in these drinks are problematic for two major reasons. First, the sugar creates a perfect breeding ground for decay-causing bacteria, which thrive when saliva flow is already low. Second, the acidity actively irritates the already dry and sensitive tissues, causing inflammation and making them less efficient at producing saliva. Even worse, sucking on hard candies or lozenges, even the ones marketed for coughs or throats, if they contain sugar or high acid like citric acid, they are part of the problem, not the solution. That temporary relief is costing you long-term comfort and dental health. The smarter swap here is clear. Instead of reaching for straight juice or soda, try infused water. Add sliced cucumber, fresh mint, or a tiny slice of orange to plain water. This gives you flavor without the corrosive acid and the sugar crash. These small, conscious changes in your liquid intake can immediately help your body start rebuilding your oral comfort. But liquids are only half the story. The next mistake involves something you put in your mouth every single morning and evening. It's likely sitting on your bathroom counter right now, and it's stripping your mouth bare. We need to talk about the products you use for daily oral hygiene. Mistake number 2, using the wrong oral hygiene products. When dealing with dryness, the goal of oral care should be gentle, soothing moisture, not harsh scrubbing and sanitizing. Unfortunately, many popular mouthwashes and toothpastes contain ingredients that are extremely abrasive or drying, making them entirely counterproductive for someone dealing with xerostomia. The most common culprit lurking in your mouthwash bottle is alcohol. Alcohol, often listed as ethanol or SDA alcohol, is a powerful antiseptic, but it's also a powerful solvent. When you swish an alcohol-based mouthwash, you are effectively rinsing your sensitive oral tissues with a drying agent. Alcohol strips away the remaining moisture film that your body is desperately trying to maintain. This leaves the tissues raw, irritated, and less capable of healing or producing even trace amounts of saliva. You get that burning, intensely fresh feeling, which ironically is the feeling of your mouth being dried out. If you are currently using an alcohol-based mouthwash, stop immediately. Look for products clearly labeled as alcohol-free. Many major brands now offer specific dry mouth formulations, but simply checking for the alcohol-free label is the most important step. Next, examine your toothpaste. While generally safer than mouthwash, some toothpastes contain foaming agents, most commonly sodium lauryl sulfate, or SLS. SLS is the chemical that makes toothpaste lather up. While generally safe, for individuals with dry mouth, SLS can be a strong irritant. It is linked to tissue irritation and can even aggravate mouth ulcers or canker sores. If your mouth feels particularly sensitive, or if you frequently notice irritation along your gum line, switch to an SLS-free toothpaste. These products foam less, but they clean just as effectively and are much gentler on a compromised oral environment. Beyond avoiding the bad ingredients, we need to introduce the good ones. Certain therapeutic ingredients can actually support moisture and saliva health. Look for products that contain xylitol. Xylitol is a natural sugar alcohol that cannot be metabolized by decay-causing bacteria. It creates an environment where plaque struggles to stick. When used in gum or lozenges, it actively stimulates saliva production in a healthy way. Another beneficial ingredient is glycerin. Glycerin is a humectant. This means it has the natural ability to attract and hold moisture from the surrounding air and tissues. Many dry mouth gels and lozenges use glycerin to provide a thin, lubricating layer that offers prolonged comfort without the irritating burn of alcohol or the destructive nature of sugar. The simple action item here is to read the labels on your oral hygiene products tonight. Ditch any product containing alcohol or SLS and replace them with alternatives featuring xylitol or glycerin. This gentle substitution allows your oral environment to begin recovering and functioning more efficiently. We've covered what you drink and what you rinse with. But the third mistake is the most subtle, often happening completely unconsciously, especially while you sleep. This mistake is a silent sabotager of your nighttime comfort. Mistake number 3, ignoring your breathing habits. This mistake is often overlooked because it's deeply tied to how we breathe, a process that should be automatic. However, if you are a habitual mouth breather, especially at night, you are actively accelerating the dehydration of your oral tissues. Think of your mouth as a leaky faucet and your breath as the evaporation agent. When you breathe through your nose, the air is filtered, warmed, and humidified before it reaches your throat and lungs. Your mouth remains relatively sealed, allowing the thin film of overnight saliva to do its protective work. But when you sleep with your mouth open, the air rushes directly over your tongue and gums. This constant airflow dramatically increases the evaporation rate of moisture, leading to the severe dryness and stickiness many experience upon waking. This is a crucial distinction. It's not just that you need more saliva, it's that you are actively blowing away the saliva you do produce. How do you know if you are a mouth breather at night? The clues are clear. Do you consistently wake up with a scratchy throat? Is your partner mentioning your loud snoring? Do you find yourself reaching for water immediately the second your eyes open? These are common signs of nocturnal mouth breathing. Addressing this requires a two-part strategy. First, we must focus on clearing the nasal passage. Many older adults suffer from chronic congestion, often related to allergies, polyps, or medication side effects. If you can't breathe through your nose, you have no choice but to use your mouth. Simple solutions here include using a cool mist humidifier in your bedroom. Humidifiers restore moisture to the air, which reduces irritation in the nasal passages and helps prevent overnight evaporation. Make sure to keep the humidifier clean to avoid mold buildup. Another immediate step is using over-the-counter saline nasal spray before bed. Saline helps clear congestion and inflammation, making nasal breathing easier. The second part of the strategy involves gentle training to encourage nasal breathing. Certain sleep strips, worn externally over the nose, can physically open the nasal passages, making the switch effortless. For those who are comfortable, sometimes a small piece of special porous tape, carefully applied across the lips before bed, can physically encourage the lips to remain closed. This forces you to use your nose. However, always consult with your primary care provider or sleep specialist before trying physical breathing aids like tapes, especially if you have diagnosed sleep apnea. Remember, the goal is not perfection, but progress. Even reducing your mouth breathing by half will result in noticeable comfort improvements the next morning. It saves the saliva you are already generating. Now that we have exposed the three critical mistakes, the wrong drinks, the harsh products, and the silent breathing habit, we can pivot to the positive. You need a simple, evidence-based plan that actively promotes long-term salivary health. We call this the three-step right way plan. This is the payoff. This is how you stop the doom loop and start enjoying your food and comfort again. The three-step right way plan starts with step 1, smart hydration. We already established that chugging large amounts of coffee or sugary drinks is counterproductive. Smart hydration is about continuous, small inputs of pure water. Think of your body like a plant. You wouldn't water a plant once a week with a bucket. You would provide constant, gentle moisture. Your goal is consistent microsipping. Keep a small water bottle with you at all times. Set a simple, non-intrusive reminder on your phone or smartwatch to take 3 sips every 15 minutes. This consistent flow prevents your mouth from ever reaching that crisis level of dryness. If plain water is boring, make it better. We discussed infused water, but consider bone broth. Warm, low-sodium bone broth is excellent for hydration because it contains natural electrolytes and gelatin. Electrolytes, like sodium and potassium, help your body efficiently absorb and retain water, keeping you hydrated longer than plain water alone. Sip a small cup of warm broth in the mid-afternoon instead of a dehydrating tea. Step 2 is the power of mechanical stimulation. Your body is designed to produce saliva when prompted, usually by the act of chewing. We need to trick your body into making more saliva naturally, and the best way to do this is through healthy, sugar-free chewing. The key component here is xylitol gum, or lozenges. Unlike regular sugar, which feeds bacteria, xylitol actually starves them. Chewing this gum for 5 to 10 minutes stimulates the parotid glands, which are the major saliva producers. This is a powerful temporary fix that also protects your teeth. Aim for 1 piece of xylitol gum after meals. This helps wash away food debris and encourages saliva flow when you need it most. If chewing gum is difficult, try incorporating more fibrous, crunchy foods into your diet. Think fresh apple slices, carrot sticks, or celery. The effort required to chew these firm vegetables and fruits naturally stimulates salivary flow. These foods also provide excellent nutritional benefits and are a far better alternative to dry, starchy snacks like crackers or pretzels. Crunchy foods are your new best friend against dryness. Step 3 is the nightly protective routine. Your mouth is most vulnerable to damage while you sleep, when saliva flow naturally slows down to almost nothing. You need to create a barrier of protection that lasts all night. First, Invest in a specialized moisturizing rinse or gel. These products are explicitly designed for dry mouth. They often contain that beneficial glycerin or special enzyme blends that mimic the lubricating properties of natural saliva. Apply a small amount of the gel to your tongue and gums right before you turn out the light. This thin, invisible film acts as a shield against that overnight evaporation we discussed. Second, consider using a high-quality fluoride product. Since dry mouth significantly increases cavity risk, aggressive prevention is non-negotiable. Talk to your dentist about a prescription-strength fluoride toothpaste or rinse. This provides maximum protection against decay, hardening your tooth enamel in the vulnerable dry environment. These simple nighttime additions take less than 2 minutes, but they provide hours of comfort and critical dental protection. These 3 steps, smart hydration, mechanical stimulation, and nightly protection, form the backbone of your new effective routine. You have stopped the bad habits and introduced powerful, evidence-based practices. Now, let's address a common concern for our Silver Smile and Bites audience: medication. The honest truth is that for many adults over 55, dry mouth is a direct side effect of necessary medications. This isn't a mistake you're making. It's a trade-off required for managing blood pressure, depression, anxiety, or allergies. More than 400 medications are known to cause dry mouth. You cannot simply stop taking your prescriptions because of an uncomfortable side effect. That would be irresponsible. Instead, we manage the problem proactively and professionally. Your next action step should involve communicating clearly with your doctor or pharmacist. The first strategy is to ask about timing. Sometimes, simply adjusting the time you take a medication can dramatically improve comfort. For example, if you take a diuretic in the morning, taking your highest dose of a drying medication just before bed might increase overnight discomfort. By shifting the dose time slightly, with your doctor's approval, you might move the peak side effect period to a time of day when you can more easily manage the dryness through microsipping. Always discuss any timing changes with your prescribing physician first. The second strategy is to inquire about alternatives. Medications within the same class often have slightly different side effect profiles. You can approach your doctor with confidence and ask this direct question: I am experiencing significant dry mouth. Is there an equally effective alternative medication in this class that has a lower known xerostomia side effect profile? This shows you are actively participating in your care, and often a small tweak to your prescription can bring immense relief without sacrificing the benefit. Remember, dry mouth is a serious health concern, not just an annoyance. It impacts your quality of life and dental health, so your doctor should take this side effect seriously. Third, if the medication is absolutely essential and alternatives are not available, there are prescription saliva stimulants. These are called sialagogues. They require a doctor's order and are usually reserved for severe, persistent cases. They are not a first resort, but they are a viable option if lifestyle changes and over-the-counter products fail to provide adequate comfort. This brings us to a final, very important note on when dry mouth is a sign of something more than just a medication side effect or a bad habit. If your dry mouth is accompanied by other noticeable symptoms, you need to see your doctor right away. What are these red flags? Look out for persistent burning in the mouth, changes in your ability to taste food, or severe difficulty swallowing that interferes with eating. Also watch for dryness that extends beyond your mouth, such as extremely dry eyes or dry skin, which could be linked to an autoimmune condition like Sjogren's syndrome. Or, if you notice your dry mouth is coupled with unexplained weight loss or excessive urination, that could signal something like undiagnosed diabetes. Dry mouth is a common symptom of many systemic health issues. By being aware of your body, you empower yourself to seek timely treatment. Don't fear the warning. Embrace the knowledge. You now have a complete, effective plan. You have identified and stopped the 3 key mistakes: the dehydrating drinks, the harsh products, and the mouth-breathing habit. You have adopted the 3 core principles: smart hydration, mechanical stimulation, and nightly protection. You don't need magic pills or complicated procedures to fix this. You just need gentle consistency and the right knowledge. Take action today. Stop making those 3 common mistakes. Implement just one of the 3 right-way steps right now. If this guide helped you cut through the confusion and feel empowered about your health, please like this video. Subscribing ensures you get all our future guides designed to simplify your journey to vitality after 55. Take control of your comfort. You deserve to smile brightly and eat deliciously every single day.